Luciano, question for you. This is my most top question of the week for you. If masks work, why can't we work? All right, everybody, welcome to the Lion's Den. I got Dr. Shiloh here and Dr. Luciano. Thank you for being on the show. Today is the first Sunday in May, and they're going to talk to you about what's going on with the virus update. Dr. Luciano, tell us what's going on with Bucks County. They opened up some of the state golf courses, other things, but Bucks County, Philadelphia is pretty much on lockdown coverage time. Can you tell us what's going on?
Yeah, so we're looking to hopefully move into this yellow phase, and we have some requirements for number of cases. I think it's 50 per 100,000, so it translates to about 22 a day per for the average over 14 days. So we're trying to get to that number. There's a couple of considerations. Number one, I think a week or two are like in the 120s, 130s. I think we're coming down, so we've hit our peak. We're coming down, and the interesting point is most of these cases are nursing home patients. So I think 75% of the deaths in Bucks County are related to nursing home or long-term care, and I think 60% of the new cases are basically related to that as well. So we're looking at community spread, and if you consider that in the numbers, I think we might get to our numbers a little bit quicker if those numbers are taken out.
If you just back out 60% of the 120, it's going to be about 70 of the people. That means you're going to be at about 50, 60 people right now. We got to cut it almost in half of now. Is that what you're saying, Dr. Luciano? We should be able to open up?
Yeah, so I think the average. So, and also, I'm not sure if they're going to lump us into the other counties in the Southeast region as well. So if that's the case, we have to consider what's going on in Philadelphia as well.
Is Philadelphia on the uptick still, Dr. Shiloh?
No, I mean, Philadelphia is plateaued, but plateau still means a lot of cases every day. It's just not going up. It's plateauing and then trending towards down, but there's still a long way to go for us to reach the guidelines that have been set nationally and locally as well to release the restrictions that we imposed in order to, bring this thing to a standstill. And I think we're doing a good job. We just have to continue doing it. And then, let's make sure that we do things safely when we open up.
We were all out this weekend yesterday. Everybody saw, we had discussion. People, parks, urban golf, they're packed. They're packed, and people aren't social distancing at all. Dr. Shiloh, can you say what you think about that and what you've seen?
Yeah, I mean, I myself have been out to the parks with my family, trying our best to stay away, but there are people who either willfully are doing it to prove a point, or they're just not really seeing the threat. Obviously, it's an invisible threat. I think if you looked at everybody around you and imagined them that they had the virus and were infected, which is what I try to tell people, look, everywhere you go, wherever you go, that person standing next to you has the virus. If you imagine that, you will step away a bit. And unfortunately, we've been cooped up and people want to get out, and I totally get that. I get out. But I think there's a way to do it and do it safely. There's certainly a methodology to it. You can go for a walk and still stay 6 feet away from other people. And there is a way to do it safely. I mean, I think we all want to get out, and I think we all should get out. But I think there are ways to do it safely because we've made a lot of progress. And sadly, the actions of a few can set back the many of us who are actually continuing to adhere by the rules. And that's a shame. We really should continue our best to adhere to the social distancing policies so that we don't have to lock back down again soon enough. We're so close to getting to a more relaxed way of living that we don't want to go back in time. And the only way to do that is to continue to adhere to the proper rules.
Dr. Luciano, question for you. This is my most top question of the week for you. If masks work, why can't we work?
So masks are intended to decrease the amount of virus spread in the environment. It's not an effective way to prevent you from getting it. You can still get that virus with wearing a mask. It's not a complete seal. Studies show you can fumble around with your mask and touch areas around your face, and that can make you even more prone to it. Also, there's other introductions like eyes and areas like that you potentially get introduction of the virus. So it's definitely not a complete safety. But it is something to help decrease the amount of virus in the environment.
People are watching these press conferences, and I've gotten probably 15, 20 emails over the last week about this. Why is Pence shaking hands in a hospital with no mask on? Why is Governor Wolf not wearing a mask? Why is Governor Cuomo not wearing a mask? Why are they close to people? You see them all exit the rooms together, walk in together. They're not doing the things they're telling us to do. Why should we do?
That's a very good question. I mean, I can't speak to every press conference that I've seen. I would say that it is, a little irresponsible of people in charge, whether or not Mike Pence is tested every 20 minutes for the virus, which he may be all the time, and that's reasonable. And his response to that particular event was that, it's preventing other people from getting sick, and he knows he doesn't have the virus because he's tested all the time. That's true, but you're also sending a message to other people in this country about their responsibility. And just to backing up for a second about masks, to Dr. Luciano's point, we also don't all have N95s, okay? If we had enough PPE and everybody had an N95 and everybody knew how to properly put it on and take it off without touching the mask, then we'd be in a different scenario. But we do have people wearing, homemade masks. And while they're sort of effective at blasting out the virus at other people, they're not nearly as effective as inhaling it. So bottom line is,
did you really have somebody come in wearing a bra sometime last week? Is that an accurate thing?
I saw a patient who had a bra that she had cut in half and was using the cup of the bra as a mask and wrapped around. And I've seen a lot of things. And look, this isn't to make a joke. People are using what they can get their hands on. So even in the hospital, you have the testing to make sure the mask is fitted properly. So, to wear a bra as a mask while I wear a bandana while we work is not an effective way of working side by side.
With the overpopulation in some of these major cities, people don't take care of themselves as much, exercise as much. You're going to have those people get sick faster. And that means if you're not taking care of yourself, your death rate would probably be higher. Would that be logical, Dr. Luciano?
So yeah, that'll just contribute to overall health. So yeah, I think the factors that affect your mortality, the death rate, are certainly all those chronic conditions that we all heard of, as well as general health. So that's all factors. So I mean, I think the different numbers in different states is reflective probably of that. And a good example is if you look at Italy, the population that got affected was elderly, sick, close density, and look at the mortality rate. I mean, it was really high. So you got to compare, apples to apples in that area. So I don't think it's necessarily a hospital level of care issue because there is no treatment. It's supportive care. So it depends on how quickly those patients get in the hospital, how sick they are, to depend on how their outcomes are as well.
So you both saw the two doctors video. Everyone saw it by now out in California. Dr. Luciano, you actually went to school with Dr. Erickson. You went to medical school with him. So you guys have.
Yeah, that's true.
You know how I feel about YouTube and Facebook taking down censorship, but we're not going to talk about that. That's a whole different conversation. People are more confused now. I mean, like, even I'm confused. I'm not saying I'm the most educated man in the world, but I got some common sense, some education. But even now, my head's spinning. I see things from people like the guy from Yale and these doctors. But you two totally disagree with these Dr. Erickson and company. I mean, can you tell me why, Dr. Luciano? I'm not asking you to say a bad word about him, but can you just tell me what, in your opinion, he did and why you think it's wrong?
So I think it's just the age of misinformation. And it's all about how you interpret numbers, and you can manipulate numbers to make them look like, your whatever desired outcome you want. Averaging out the height for an average American, but using the NBA basketball team as your numbers, and then extrapolating that data and applying it to the big community. So it's an inaccurate way of presenting those numbers. So, and it also plays on emotions of people. Everyone wants to get out and about. So, when you are relaying information, but doing it in a manner that is inaccurate, like, it can be kind of dangerous. So I'm not into censorship, but I'm also into, as healthcare providers, it's important to, when you're speaking to the public, keeping that in mind, that, you're being trusted as an accurate source. So I just think it's misleading.
Thank you for being on the show. I know you guys have a busy Sunday. Go do your to-do list. Dr. Shiloh, Dr. Luciano, thank you both. I appreciate it. Keep your business moving forward. You guys are great. Thank you, doctors.
It's really important to continue to listen to the public health officials and to the doctors and the scientists who are telling you what to do in terms of what's safest for us. We obviously all want to be out again. We all want things to go back to normal.